Thank you, Pat, and welcome to AM Arizona. AZTV is the AZTV.com is the website you can log on and find out everything you want to know. We're listening to the wonderful sounds of Michael Goodluck. We're going to be talking to him later in the show. He is a renowned Native American flutist, or flautist, whichever way you prefer to pronounce that word. Starting the day just a bit on a sad note, of course, Elizabeth Taylor dies at age 79. One of the last of that era.
Hollywood,
There's
real
a few,
true, the old Hollywood era.
Lauren Bacall is left. We have Debbie Reynolds. We have also we have Doris Day. The picture you're seeing of her right now is from 1959, Suddenly Last Summer, which was a groundbreaking movie, by the way, because it dealt with homosexuality, which was a taboo topic in that time. And of course, Elizabeth Taylor, 79 years old, known, of course, for her beauty, her marriages, and her perfume.
Absolutely gorgeous.
Can you name her husbands?
Richard Burton. That's
Hilton,
the one I...
Hilton, Wilding,
Okay.
Todd, Burton twice, Fisher. Then she married the gentleman she met in rehab. And she was married to the senator, Mr. Warner. And then there was one other.
You are amazing. I bet there's nobody else. Only you, Tanya Mock, would know that. But you know what? She was an absolutely drop-dead gorgeous woman. I think every man had a
probably her 10 to 15 year period of time at her peak, she was considered by many, if not most people, the most beautiful woman in the world. Her husband, though, Richard Burton, is on record as saying, when asked who he thought was the most beautiful woman in the world was, he said Ava Gardner, and he was her husband at the time. Ava Gardner he starred with in Night of the Iguana. And of course, Elizabeth Taylor won the Academy Award for Butterfield 8, her one time.
And you thought Richard Burton.
Oh, I liked Richard Burton myself.
Richard Burton was strong in your opinion.
Yes.
Yes.
We're going to be talking about post-traumatic stress disorder. And you do not have to have gone through a war. You didn't have to live through the Japan tsunami and earthquake. You don't have to live through any devastating event to suffer from this. We have a naturopathic medical doctor, Dr. Donese Worden, with us, and we're going to be talking about your practices in Phoenix?
Scottsdale Mesa in New York.
Oh,
so I'm kind of spreading myself.
How often do you fly back and forth?
Once a month I'm in New York, but most of the time I'm in Arizona.
Okay, talking about this disorder, again, we attribute this and we liken it to a war zone, a disaster, a devastating event. But we can experience this in everyday life.
We can. You know, we all have different stresses, and how we adapt to that is whether we call it post-traumatic stress disorder or just anxiety, a daily anxiety. When it becomes PTSD, it means that that stress or that event or events that we constantly experience have become debilitating. There's two ways that people try to adapt, and they can't whenever they get stuck. Either they're in constant anxiety, they are constantly reliving it, or they're afraid it's going to happen, or they hide, which means that they won't go out into public or into other places because something might remind them of the event. So they either tuck away or they're in a constant state of reliving it.
When they're in anxiety, that can be rapid heartbeat. They can experience they can't breathe.
Absolutely.
It's really a physical feeling, isn't it?
Right, it is, and it can be debilitating where they cannot think clearly. They're in a traumatic situation. They're actually reliving it in that moment.
Doctor,
they're having flashbacks.
What about very nervous people? You see people who are nervous about the most minuscule of things in their lives. Does that lead to...
If they are functional, if they can go to work, they can take care of themselves and their family, that's not really considered post-traumatic stress disorder. That's considered anxiety. You know, and we treat it, we need to, and they need to understand how to adapt and learn that. But when it becomes the PTSD, they have become non-functional in their lives. They cannot go through their daily activities.
But can that develop into that? In other words, a very nervous person that says, you know what, I've got dinner on 5 minutes late, or I'm in traffic and I'm nervous. Can it lead to that?
Absolutely. You know, usually we say PTSD is from an event. Now that could be a childhood event, you know, or it could be a divorce, it could be a corporate guy who it's an event that kind of triggers them. These long-standing personality behavioral disorders kind of morph into other things. you know, besides PTSD. That generally has been labeled, when we talk in psychological terms, after an event.
Okay. Now, when you're treating someone that has gone to PTSD, how do you talk them through this? How do you give them guidelines? How do you give them practices that they can put into place to alleviate this?
Right. You know, there are different ways to treat it. Most of the time you need that cognitive behavioral piece where you're talking them through it. You're letting them understand the process that they're going through, what's happening to them, so they can understand it.
But don't they know what's happening?
Kind of. They understand they're having flashbacks. They know they're anxious, but they don't understand that mechanism of why they're going through it and why they're stuck. Okay. So then we talk about, we've got to have that part, but you've got to go beyond that generally with PTSD. There are other therapies. There are many, some of the ones that are out there right now, eye movement therapy, EMDR. Those eye movements, we have our memories locked in certain eye movements, and that's used in a lot of treatment facilities now. Yeah. So EMDR is recognized for PTSD. So is a new technique called trauma release therapy. A colleague of mine, Dr. David Bruselli, in fact, he's out of the country now. I imagine he's in Japan. Most countries, after events like that, start bringing him in. He puts the body into a trauma release. So the body goes through tremors, because when you go through an event like that, the first thing we do is tuck down, and it ends up in the GI. That's why it ends up here. It's protection. And those memories are stored there. So when he puts the body back through this release, physical release, where the body literally goes into tremors, the person remembers it. They're with a counselor that's been trained in this to understand how to talk them through that. So they're releasing that physical and emotional connection.
How do they release it from their mind, though?
That's part of it. You know, that's connected. That's letting them understand that anxiety and this feeling that they have all day long is connected to that emotion. So it's just letting the body and the mind understand there's a connection between the two.
Does denial play into this?
Not so much. You know, how do you deny an event that happened? We don't deny it.
A lot of people try to escape that, don't they?
They can be a little bit afraid of it, but when they're ready, when they're in that state of PTSD, they're ready for help. They say, I can't function. Okay. They're not pushing it back like someone who might have a little depression, little anxiety that says, nah, I don't want to deal with it.
So they're aware.
These guys they're aware of it, yes.
So no one's making this up. These people are actually living that event as you watch in real time.
They can. They're either reliving it all the time, or they're afraid. They're constantly afraid in that fight or fight. Exactly. So they don't want to go out. There might be a light or a building or a person's voice that will remind them and kick them into that. So they tuck away. They're afraid for it to be triggered.
Should they challenge that? In other words, if I'm in that and I see something that sparks me, should I challenge that? Should I go forward?
No, they need to learn what they need to learn to be able to handle that when it does happen. So they've got to have their tools in place. They have had to have been taught the tools so that when that does happen, they understand it and they know what to do. The breathing, the techniques that they do to allow them to get past that and help their bodies.
You said breathing, which is very interesting to me. That's a big part of it. The deep breaths, the release.
Absolutely. For any kind of anxiety, any kind of trauma, we need to remember to breathe. And just breathing brings you back inside your body, inside your physical body, to remember that, hey, it's me, I'm okay. Another novel therapy that's out there right now is out of Russia called Scramble, and that's an acronym, but it lines up the nervous system. It gets that autonomic nervous system, that one that is in your flight or fight, and it lines it back up from a nervous system signaling, and that's how I treat it, is with Scramble technology out of Russia. And that's an immediate, they feel it, and now they realize, I can be okay.
Okay,
wow.
That was my question. So we really get the person to where we can't erase the memory. No. You can't do that.
No, it happened.
Aside from hypnosis, it happened.
Right.
So
exactly.
Get them to where they can actually remember it, but deal with it and not have it set them into a state of panic.
Exactly. They learn how to process it when that's starting to trigger them.
People who do not have that, we know that we can relive a memory and we're fine, maybe a little tear or whatever, but then we move on.
Exactly. Functional, although sometimes we think we move on, sometimes we're stuffing it.
Well,
so that's I don't want to deal with it, right?
Can I make an appointment with you?
We're going to move on right now, but doctor, stay right where you're at.
All right,
we're going to move on right now, Tanya.
We encourage you to stay with us, because when we come back, it's Michael Goodluck. It's also Karen Clarkson, but more with Dr. Worden. But first, the KFNN Money Minute.